Okay, good evening, boys and girls. Hope you all are doing well. So, your mentor at Unacademy, Dr. Reena Kaur, and today we are going to always I take NEET PG or the FMG MCQs, but today I am especially interested with the first prof. I'm going to take a topic of general physiology, which is really a very important topic, and I'll be taking it a topic something about transport across the cell membrane, right? So this we'll be considering a bit. Your mentor at Unacademy, Dr. Reena Kaur. Now, you know that the curriculum, before that, I would like to just tell you that you know that the MBBS curriculum has changed, isn't it? And you get MCQs, initially वो भी आते थे, but nowadays you get a clinical question. This clinical question is 8 marks. That means you are supposed to tell me that I'll be putting a clinical picture in front of you, and I know that you are of the first prof. So accordingly, I'm going to put. You are supposed to. I know that you are first prof, so I'm going to put a clinical question in front of you, and you have to answer that question, right? But for that, it is very important that you should be very clear that what is the question being asked for. Okay? So before that, good evening Jaswant Singh, a very good evening. So stay connected beta. Let's see that we really share knowledge lots. So Unacademy is coming up with the launching of the first MBBS professionals. We're coming up with very great offers with Unacademy doubt clarification sessions. Now let us see how exactly, when we look into the topic of transport across cell membrane, what are the things which are also called as the must known competencies. You know that when you are preparing for your first MBBS, now the strategy is there are certain questions or there are certain concepts which are must known competencies. So as far as this chapter is concerned, you have to know the cell membrane, the transport across cell membrane, a well labeled diagram of sodium potassium pump, then simple BAQs, 2 marks each, can come on GLUTs, on simple diffusion, or even you can get a differentiating point or differentiate between facilitated and simple diffusion, or differentiate between active and passive transport. So these BAQs, which are 2 marks each, are definitely a part of your examination now. Like if you look through your question papers, you will find that BAQs में ऐसे ही questions आते हैं. So मतलब आपको पता होना चाहिए कि when I'm reading a particular topic, what are the must known competencies, what can come as LAQ, as your BAQ, and also as your brief questions, plus what are the expected MCQs, right? So there has to be very systematic learning. Now let us see, if I give you a case history, suppose I am giving you this as an 8 marks question, I am putting a clinical history in front of you. A 43-year-old man presents to the physician's clinic having a complaint of epigastric pain, right? And after a thorough workup, the patient is diagnosed with peptic ulcer disease. So what I have done over here, I have given you the diagnosis that it is a peptic ulcer disease. Okay? Now he is started on the medication that is inhibiting the proton pump of the stomach, right? So this is a very typical clinical based question which you get in your first prof, and it carries 8 marks, right? So if you know this very well, it is simply asking something about proton pump. That means I expect that you should know your active and passive transport, है ना? That topic is really very important, और उसमें से MCQs भी बहुत सारे आते हैं. So if I give you this clinical history, I'm going to now put this into first MBBS, which is going to be presented to you. So I hope this made your picture very clear कि कैसे questions हमको आ सकते हैं, right? So if I want to answer, so if I'll answer this question, I know that this is a proton pump inhibitor, and the proton pump inhibitor which is being spoken over here is the hydrogen ATPase pump, which is present in the parietal cells of your stomach, that is responsible for your acid secretion. And because it is a pump, it is an example, or it is a type of active transport mechanism. Now, what type of cell membrane transport is this? As I told you, because it is a pump, it is a primary transport. What other types of transports you know? So here I have taken, suppose, simple diffusion, facilitated diffusion, secondary coactive transport, and so on, right? So this is the way a question is going to be put to you, and this is the way you're going to answer this question, right? Now let's move on to the theory of today, that is the transport across cell membrane. Now whenever you do a transport across a cell membrane, a very important briefing that is required is about the structure of the cell membrane. You know that the structure of the cell membrane, it is a lipid bilayer having hydrophilic heads, isn't it? Hydrophilic heads, and these are your fat, sorry, you've got the hydrophilic and the hydrophobic regions of your phospholipid, right? And what is freely permeable to this cell membrane? So the cell membrane is freely permeable only to your lipid soluble substances or your gases or your steroids. That means those which are lipid soluble can easily pass through this cell membrane. Now suppose if I put a question to you, suppose I say steroids, they will show which type of diffusion? They will show a simple diffusion, or they will show a facilitated diffusion, or they will show an active transport mechanism. A simple MCQ I can put upon. Now what did I learn? I learned that the steroids are lipid soluble. That means they can easily pass through the cell membrane. Therefore they will show you simple diffusion. So this is type retrospectively. You have to prepare yourselves for MCQ. Another important thing which you know is that the cell membrane has got these proteins, right? These are transmembrane proteins which are piercing the cell membrane through and through, or integral proteins. So the transmembrane proteins itself are called as the integral proteins. For example, your G protein, then your various pumps, then your pores, your channels, all these are your integral proteins. Whereas you have got peripheral proteins which can be attached on the cytosol, and the peripheral proteins can also be attached extracellularly, right? So those which pass through and through are the integral proteins. Those which are attached either on the cytosol side or either on the cell surface, they are your peripheral proteins, right? Now the different type of transport mechanisms, just enumerate. This can again be a 2 marks BAQ, right? What are the different types of transport mechanisms across the cell membrane? So this can again be a 2 marks BAQ to you. So I must know that you classify the transport process as active, passive, active. You have got vesicular transports and you have got transports across the epithelium. So the passive transport includes simple diffusion, facilitated diffusion, osmosis. These three compulsorily you should remember. If you are able to add, you can remember filtration, bulk flow and solvent drag. But these obviously you need to remember. Again, these are must known competencies, I could say. The active transport is defined as the primary and the secondary active transport mechanisms. And we will see now that the secondary will be further classified as a co-transport. The co-transport, which is also called as a symport, and a counter-transport, right? So secondary can be a co-transport, also called as a symport, or a counter-transport, that is also called as your antiport. Apart from this, there are vesicular transports. That means a vesicle is formed. So it could be exocytosis and endocytosis. And the transport across the epithelium, which can be transcellular and paracellular. What is this? So if it is passing through the cell, it becomes transcellular. But if suppose there are two cells and the substances are passing between these two cells, especially there are presence of tight junctions between the two cells, and जब इसके through कोई चीज pass होती है, then that becomes your paracellular transport. So just enumerating, and if enumerate very correctly, you get 2 by 2. I don't have any scope of deducting any marks. So these are one of the simplest and one of the scoring type of answers. And if you look into your question 1 is your MCQs, and the question 2 is your BAQs, and you have to form you have to answer 10 BAQs. Okay, you have to answer 10 BAQs, and I think you've got 11, उसमें से आपको 10 करने पड़ते हैं. Now let us see the differences. Suppose I give you suppose I ask you to differentiate between active and passive transport. So how you're going to make a table of it? This can again come as a 2-mark BAQ. Now first, why active is active? Because it uses energy. That means there is breakdown of ATP, right? There is a breakdown of ATP, so it is using energy. Whereas passive, there is no use of energy. So because there is no use of energy, it is passive. Active is against the concentration gradient. Against the concentration gradient, and therefore it is also called as uphill, right? Uphill. Whereas passive is along the concentration gradient, and because it is along the concentration gradient, it is also called as downhill. Okay, so these are the two differences which I am expecting that you must write. Now because it is using energy, it is a kind of a metabolic process, and it is just downhill along the concentration, it is simply a physical process. To enhance or to beautify your answer, you can write the examples active, passive, and you can write over here it is osmosis, it is diffusion. Diffusion can be your simple diffusion and your facilitated diffusion. So if you write this much, definitely 2 upon 2 you get. You see how many lines are there? 1, 2, 3 and 4. That means 4 lines are quite sufficient for your 2 marks answer. But now this time when I was evaluating the papers, university papers, you have wasted your time in this 2 marks question. Many of the students have written full 1 page. Beta, even if you write full 1 page, maximum marks that I can give you is 2. So why are you wasting your time and energy even if you know it is not needed, right? So if it is a 2-mark question, I don't expect you to put more than 4 lines in it. Time management is lacking. That is really to be improved. Now very important MCQs which become are, or I can put you another answer, give me examples of active transport, right? So we have got our primary active transport and we have got our secondary active transport. We have classified the primary and the secondary as our co-transport and counter transport. What is co-transport? I'll show you the figures also. Co-transport means the 2 molecules which are going to be transported, they will travel in the same direction, right? They will travel in the same direction. That means either both of them are inside or outside, but together. Usually it is inside the cell. Counter means they are going to be transported in different directions. So one is inside and the other is outside. Other is outside, right? Now, primary means there is hydrolysis of ATP. So very common example is the sodium potassium ATPase pump. Very, very important is the sodium potassium ATPase pump, which is present in almost all the cells of the body. One of the very, very important energy consuming pump. Rather, this itself is a BAQ. You can get a BAQ over the sodium potassium pump. But apart from this, if I ask you, give me any other examples, so you just don't know and then you fail to give me any other example. How can I forget the hydrogen pump? This hydrogen pump which is present in the parietal cells of stomach, right? In the parietal cells of stomach, which is secreting HCl. Another example is the presence of this hydrogen pump in the intercalated cells of kidney. Intercalated cells of kidney, wherein this is responsible for the acidification of urine. Right? So two important sites, and again these become MCQ also for us. So we have to study in such a manner that we are going to deal not only with the brief or with the theoretical questions, but we should be very much efficient to deal with the MCQs also. Now, counter transports, as I told that both of them are going to move in different directions, one inside and one outside. Very common and very important example is the sodium hydrogen exchanger. Where is it present? It has got a very common site, or one of the most important site you can remember is the PCT, that is the proximal convoluted tubule of kidney. Right? So one example at this moment. Another one example you should remember is the sodium calcium exchanger. Sodium calcium exchanger, which is present in the cardiac muscles. Then you have got a bicarbonate chloride exchanger. The bicarbonate chloride exchanger, which is present in your RBCs. Right? So these are the important examples of your counter transport. Now if we look into the co-transport, that is substances which are going inside the cells or in the same direction, very common is your sodium glucose. This is also called as SGLT, and this SGLT is a very important MCQ every time. Apart from this, you will have sodium amino acids, right? You can have sodium bicarbonates, you can have sodium iodide symporter, which is present in the thyroid cells, right? Then you've got sodium with chloride co-transport. You've got sodium with bile salts. Bile salts. This is present in the ileum. So you can see I can enumerate so many examples to you. So how can MCQ come to us? An MCQ can come to us. Sodium bicarbonate is an example of. So it is an example of co-transport, energy consuming but a secondary co-transport mechanism. Now, what is the basic difference between your primary and secondary active co-transport mechanism? What is the basic difference between your primary and your secondary when you take active? So what is the basic difference between the primary and between the secondary coactive transport mechanism? I told you that both of them are using energy. Both of them are using energy because we've categorized them as active. However, primary is using directly hydrolysis of ATP, but secondary is not causing a direct hydrolysis of ATP. So this difference has to be very nicely understood. See, this is the sodium potassium pump which is present on the basolateral side of the cell, right? On the basolateral side of the cell, you have got the sodium potassium ATPase pump. And on the luminal side, right? On the luminal side, there is presence of a co-transporter. Suppose this is SGLT. So suppose I am taking an example in the intestine and trying to explain you the difference between the two. Now, what is sodium potassium pump? I'll explain this in detail, but for time now, just remember that this is a pump which is going to throw sodium outside and take in your potassium, right? It will take in the potassium into the cells and it will throw the sodium outside. So just a moment later we'll study it in detail, but just for time being, remember. Now when it is doing this, it is causing hydrolysis of ATP, and that means it is using energy by causing direct hydrolysis of ATP. Now it is throwing the sodium outside. So what is the effect? The effect is that the sodium concentration is decreased inside the cells. This leads to a concentration gradient. Okay, this leads to a concentration gradient. That means the sodium concentration inside the cell is decreased. So this is leading to a concentration gradient. Second important thing is that sodium is a positive ion. So if the positive ion is leaving the cell, it is creating negativity inside the cell. That means it is also creating an electrical gradient. It is also creating an electrical gradient. So hydrolysis of ATP and the sodium being pumped out are creating two important gradients, the electrical gradient as well as the concentration gradient. These gradients are very, very strong, and they can enable, what they can do, they can cause sodium to come inside, because the sodium concentration is low. So now sodium just wants to come inside, right? This will also allow any other substance, suppose over here it is glucose, the glucose to bind with this, and the sodium के साथ में glucose is going to be reabsorbed because of a very strong concentration gradient being created by the low sodium inside. So this is the basic difference between primary and secondary, that the primary is causing the direct hydrolysis of ATP and creating a gradient. That gradient is utilized by the secondary coactive transport mechanism, which is not directly causing the breakdown of ATP, right? And remember that you get one applied part of it regarding ORS. जब हम ORS का solution add करते हैं, so we are adding glucose, we are also adding salt to it. Now did you get the meaning? If you want to reabsorb glucose, you require salt. What is salt? Your simple NaCl. That means when you are reabsorbing glucose, you will also reabsorb sodium. Second advantage. Third advantage, that whenever there is reabsorption of sodium, water comes behind sodium because sodium has got a very, very high osmotic effect. So just adding glucose is contributing to water as well as water reabsorption as well as sodium reabsorption, and therefore it becomes so favorable. So this applied I'm expecting from my first profs, right? Now moving ahead is to your simple diffusions and your facilitated diffusions. So if we take the difference between both of them, again remember this comes as a BAQ. So what is simple diffusion? No carrier is required. No carrier. It is just along the concentration gradient. This gradient can be your concentration gradient. That means the concentration of the substance can be more on one side and it will move, or it could be a pressure gradient. You know that why are we taking in oxygen? Because the oxygen concentration is more in the atmosphere. Why we give out carbon dioxide? Because the carbon dioxide concentration is more inside the alveoli, isn't it? So even the gases are moving along their concentration gradient. Or it could be a temperature gradient. If you increase the temperature, you're going to increase the movement. Because diffusion कैसा होता है? It is just because of the collision or the random movement of the molecules, right? Now, so यहाँ पर in simple diffusion no carrier is required, whereas in the facilitated diffusion you require a carrier protein. Now in simple diffusion, because no carrier is needed, it does not show any saturation. That means if you keep on increasing the substance, the diffusion will keep on increasing. We'll explain this with the help of one graph. Whereas facilitated diffusion shows saturation kinetics. That means initially the rate of diffusion will increase, but then saturation will occur and the substance cannot be transported. A very common example which you should know in your applied aspect is the glucose which comes in urine in the patient suffering from diabetes. What occurs? This glucose is reabsorbed from the PCT with the help of your SGLT2. right? Now suppose there are 100 carrier molecules and there are about 90 to 100 glucose. What will happen? All the glucose will be reabsorbed, right? But if the glucose becomes 150 or 200, then what will happen? The carrier proteins will become less in number and 100% glucose will not be reabsorbed, and the remaining glucose will be passed or excreted in urine. That what results in a glycosuria. That means the urine becomes positive for glucose, right? Facilitated diffusions, they show competitive inhibition which is absent in simple. What is competitive inhibition? Now there is a carrier protein. This carrier protein can bind to glucose as well as it can bind to galactose. For example, your SGLT. It can bind to glucose as well as galactose. That means it is suffering from competitive inhibition. The rate of diffusion is faster with facilitated, whereas it is slow with your simple diffusion. And finally, there is no specificity in simple diffusion, but here it is very specific. It is also called as a stereospecificity. What is this? For example, there is a carrier protein which will transport L-glucose. If it is transporting L-glucose, it may not transport the D-glucose. That is called as a stereospecificity. So this table is very, very important. So whatever tables today we've taken, like difference between active passive transport or this simple facilitated diffusion, these are most expected BAQs, 2 marks each for your examinations in the first Prof University exams. Now, see, you can see over here, facilitated diffusion, that molecule to be transported will bind on this receptor. Now, no energy is needed, although it is using a carrier protein. No energy is needed, right? It is simply down its concentration gradient, and it is simply occurring because of a conformational change in the carrier protein. You are bringing about a conformational change in the carrier protein. Can you assess? See, this was the protein ka shape, and after it bounded to the protein after the receptor bounded to the transported molecule, a conformational change which allowed the substance to be released, right? So a carrier protein is needed, but no ATP. Very common examples are GLUTs and urea transporters. These are seen in the kidney. There are lots of GLUTs, and like you study, there are about 7 type of GLUTs which are there. Now if I put an MCQ to you, SGLT and GLUT, which is an example of active transport. This is one of the commonest mistake we make. Now I told you that this is an example of facilitated diffusion. But SGLT is the sodium glucose co-transporter. So it is an example of secondary coactive transport mechanism, right? So here you can see that I have taken a table which is actually in the form of a flow chart, a circle, or the events which are taking. That is, the solute to be transported will bind to a carrier site, and after binding there will be a change in the conformation. The molecule will be released and the carrier protein will again go to its first stage to be recycled, right? And this is a very fast process in comparison to your simple diffusion. Now see, so we are going to explain the same thing with the help of a graph. On the x-axis there is concentration gradient, on the y-axis there is rate of diffusion. Vmax is the maximum. Now this is a linear correlation. So a linear correlation means simple diffusion. That means if you keep on increasing the concentration of solute, right? If you keep on increasing the concentration of solute, then also the rate of diffusion will increase along with it. Because it is simple, it is going to be shown only by your lipid soluble substances or your gases. On the other hand, this is your facilitated diffusion. See, again I take facilitated diffusion. You are getting a plateau. What is the reason of this plateau? The reason of this plateau is because of the saturation of my carrier proteins. Right? Saturation of my carrier proteins. Samir, today I won't take membrane potential, but I promise you that I will take it in another session. I'll definitely take. And boys and girls, I'm going to plan another class, right, very soon, especially for the first MBBS, and that topic I'm going to take on the clinical based question that was already taken in this university exam. So in this university exam, you had 2 clinical cases and there were questions related to it. So I'm going to probably take them very soon. Let it be Saturday, Sunday or Monday. The time will be again 8:30 p.m. So what do you want? Should I take the molecular mechanism of muscle contraction? I'm giving you option. Or should I take adrenal cortex? That means the cortisol, or the molecular mechanism of muscle contraction. These 2 questions, they came as clinical based questions to you. So I'm going to plan this on the YouTube as well. Yes, Samir, I'll definitely take beta. So remember that this is the plateau, which is because of the saturation of the carrier protein. So if you're getting a plateau, it is facilitated diffusion. The commonest example to be remembered is glucose. Okay, Samir. Finally, because Samir has promptly answered me, so I'm going to take the molecular mechanism of muscle contraction as my another YouTube session very, very soon. Thank you, Samir. So we've already completed, but we can take this. I have taken this because this comes as an SAQ, again 2 marks. Suppose you have to write it. So how are you going to write? Primary, right? Primary, that is direct use of energy. Example, sodium, potassium, ATPase, circa and hydrogen pump. What is circa? It is the same, the calcium ATPase pump. Right? Secondary could be symport and could be antiport. So we've taken the examples, but this is the way you are supposed to write down the questions of 2 marks when it comes as an SAQ. Don't waste time in writing big questions when it is just of 2 marks. Now, this can come as an image based question to you. I mean, draw a well-defined or a well-labeled diagram of the sodium potassium pump, right? This can definitely come as a diagram, or even there is a short note on the sodium potassium pump. Now what or how will we do this now? See, सबसे पहले तो you should know that the sodium potassium ATPase pump, the first line which I should write, is an example of primary active transport. It is an example of primary active transport. This pump has got a coupling ratio, right? This pump has got a coupling ratio of 3:2. What do you mean by that? This means 3 sodium will be pumped outside, right? 3 sodium will be pumped outside and 2 potassium will be taken into the cell. So 3 sodium will be taken right. So 3 sodium will be pumped outside and 2 potassium will be taken into the cell, right? So now if you have to pump 3 sodium outside, where should the sodium bind? Definitely the sodium should bind on the inside, that means in the ICF. So the binding site for the sodium will be inside in the cytoplasm, right? Whereas you have to take the potassium inside. So where will the potassium bind? The potassium will bind outside. So this is very important in your PG examination. This comes as image based questions and it is asked with an image like what is binding where. Now this you can see is a pump which is also called as a heterogeneous heterodimer, having alpha and beta subunits. These beta subunits are just meant for glycosylation, whereas the alpha subunits have got binding site for all the substances. For example, you can see that on the inside there are binding sites for sodium, phosphorylation site and ATP binding site. So all of them are present inside. Outside you've got sites for binding of potassium and QBank. This QBank is nothing but it is digitalis. What is digitalis? It is called as a cardiac glycoside. What is cardiac glycoside? It is a drug which increases the force of contraction of heart. Right? Force of contraction of heart, which is also called as your positive ionotropy. It is called as your positive ionotropy. So this is very important. Now if you just want to elaborate the functions of this sodium potassium pump, first is it is an electrogenic pump. Electrogenic pump, right? It is contributing to your BMR. Why electrogenic? It is throwing 3 sodium outside and taking 2 potassium inside. That means there is a net loss of 1 positive ion. There is a net loss of 1 positive ion. So this being the electrogenic pump contributes to our resting membrane potential, right? It being a electrogenic pump, it contributes to our resting membrane potential. Now it is a pump that affects BMR because it is an energy consuming pump. Hormones like thyroxine, or you can remember your thyroid hormones, they are increasing your BMR basically because they are increasing the activity of the sodium potassium ATPase pump, right? And the last very important effect or role of this is it regulates the shape and volume of the cell. How? If the pump fails, what will happen? The sodium will keep on accumulating inside the cell. And I told you that sodium is osmotically very active. So if sodium remains inside the cell, it is going to get water into the cell. The cells will swell and they will burst. So sodium potassium pump is very important SAQ as well as BAQ for you. So this is, we've already seen secondary coactive transport mechanism where both the substances, they are going in the same direction. So glucose is low outside and high inside. Therefore, it is called as against the concentration gradient. Whereas sodium is moving along the concentration gradient, and this gradient is created primarily by the sodium potassium ATPase pump which was working on the basolateral side. So this pump is enabling the secondary coactive transport of sodium along with glucose, and it is coming inside. And you again see a conformational change with the carrier protein. So these are your examples of symporters, that is co-transport. As I told you, both the molecules coming inside. For example, this is sodium amino acid, sodium glucose, this is your sodium and bicarbonate. Symporters, or what we call as the co-transporters. What is important is that both of them are coming in the same direction, right? So they're coming from outside to inside. Right? So you can just see one more time, the things become very, very clear to you. Yes. So both of them coming in the same direction. This is what to be done. Both of them coming in the same direction. Right? Both of them are coming in the same direction. Now this is your antiport, that is your counter transport, where one substance will move in one direction and the other substance will move in another direction. That is, one is moving inside and the other is using outside. So I've taken sodium, calcium and sodium hydrogen over here. So again, extracellular, intracellular, and can you see the direction, boys and girls? Now just look over to the directions, right? So sodium and calcium, sodium is coming inside and calcium outside, and यहाँ पे the sodium is taken in and the hydrogen is given out, and this is sodium bicarbonate exchanger. So are you able to appreciate the difference between the symporters and the antiporters? Now the third type of transport which I told you is a vesicular transport. That means you are forming the vesicles which will be transported. So if you are throwing something outside, exocytosis, or if you're taking something inside, endocytosis, and remember that these are also example of active transports. They are not passive because they use energy, and they also use very important ion, that is your calcium ion, right? Now before we conclude the session, let's take few MCQs over here. Why sugar is added to ORS? A simple MCQ which I am expecting from my first prof. It enhances acceptability, enhances taste, enhances the shell life, or enhances the salt absorption. So why are we adding sugar to the ORS? Every one of you, we do this at home, isn't it? We take salt and water, but what is the physiology behind? Now we've already studied that the sodium, glucose, they are co-transported because glucose needs sodium, isn't it? So it will also enhance the salt absorption. And what did I tell? That whenever you are reabsorbing salt, water is going to be reabsorbed by osmosis. Next one. Which of the following is true about SGLT1? It is a secondary active transport glucose in the brain, secondary active transport in the intestine, in the prostrate, or in the rods and bones. SGLT1. So again, it is an example of a secondary co-active transport mechanism. So the answer is 1. So you have got SGLT1 which is present in the intestine, and you have got SGLT2 which is present in the kidney, in the PCT, responsible for the glucose reabsorption there. Now, which of the following is correct about the function of the antiporters? Both molecules go in, one molecule goes in and the other molecule goes out. Both molecules go out, one molecule goes in and two exit out. Yes, now we know that what is antiporter. One molecule will come in one direction and the other will go in the another direction. So this we've completed already. So these are the important MCQs which can be related to this topic. Now one thing which you should know whenever you have to study the simple diffusion. This is based upon the Fick's law of diffusion. Fick's law of diffusion, and this again comes as an MCQ also. Fick's law of diffusion is associated with, so it is with diffusion, that is simple. This says that J is equal to minus dA dC by dx, where J is the net rate of diffusion. D is called as your diffusion coefficient. This D depends upon the properties of the substance to be transported, right? It can be given as S divided by square root of molecular weight, where S is the solubility of the substance and mW is the molecular weight of the substance to be transported. Apart from that, it will also take into consideration the charge carried by the substance. A stands for surface area. dC is the concentration gradient. And dx is the membrane thickness. So if you just look into the formula, you yourself know that the rate of diffusion is directly proportional to surface area, to concentration gradient, and inversely proportional to the membrane thickness. Why are we using a negative sign? We are using a negative sign because we are moving towards decreasing concentration, isn't it? We are moving from high to low, therefore using a minus sign. Now suppose you take conditions like emphysema. You know what is emphysema? It is an obstructive airway diseases. What happens over here? There is lots of alveolar damage, which is going to decrease the surface area. Therefore, with the decrease in the surface area, the rate of diffusion will decrease, right? Suppose you take a condition like asthma, you take a condition like fibrosis. In these conditions, there is going to be increase in the membrane thickness, and you've seen that thickness is inversely proportional. So if there is increase in the membrane thickness, again there is going to be decrease in diffusion. But if you take an example of exercise, what happens in exercise? There occurs opening up of capillaries. More and more capillaries which were initially not opened will open up. There will be distension, there will be recruitment. All this is going to increase your surface area and again increase in diffusion. So this is how whatever you are learning in physiology, you have to correlate it with clinical side, because you know nowadays the study patterns are vertical integration. You have to know the importance of it, you have to correlate it right clinically. Now suppose solubility. You know that carbon dioxide and oxygen, the molecular weight of carbon dioxide is 44, that of oxygen is 32. But still you know that the solubility of carbon dioxide is much more than oxygen, right? The solubility is much more than oxygen, and therefore the rate of diffusion of carbon dioxide is more than the rate of diffusion of oxygen. So everywhere you have to apply physiology so that you are able to correlate it clinically, right? So I think, boys and girls, the lecture was sufficient for you and you really learned through this lecture. I'll be coming up, as Sameer has told me, to take the molecular mechanism of muscle contraction. So I'm going to probably plan it on Sunday or Monday. I'll schedule it before time so that you get a notification. If you want to attend my free classes, you can just join me on my Telegram channel. I am, you can search me as Physiology Revision Dr Reena Kaur. Okay, Physiology Revision Dr Reena Kaur. You can join the channel. I'll be putting on the links which I am taking as a special class on the platform of Unacademy, which are free classes. You can definitely join. To all my special first MBBS Prof sitting over here, we are conducting, right? So with this, I think we come to an end of this session, and a happy learning, boys and girls, and keep your learning very happy. So we meet very soon next time. So bye bye and thank you.